afternoon. Welcome to the Spring Panel Series 2021 at the Catholic University of America in Washington, D.C. In this three-part series, we will be talking about architecture, cities, and architectural education in a post-pandemic world. There is little doubt that the ongoing pandemic has profoundly affected the entire world with unimaginable economic, social, public health, urban, and environmental consequences. It has exposed, among other vulnerabilities, our weaknesses in disaster preparedness, the inadequacies in creating inclusive public health infrastructures, our privileged hesitation to tackle racial, social, and gender injustices, and our misguided policies of urban governance and spatial management. The pandemic has also compelled us to question some of the fundamentals of our lives, politics, societies, institutions, and spatial practices. Is it time for change? Is it an existential moment for reimagining the nature of change itself? Albert Einstein once said, quote, "The world as we have created it is a process of our thinking. It cannot be changed without changing our thinking." End quote. How do we know when our thinking and the world it produces need change? Does that moment arrive as part of natural cycles or because of human action? American philosopher Thomas Kuhn, what is the politics of paradigm shifts in the first century, particularly in the wake of the global pandemic? Norman Foster recently wrote, quote, "Rather than changing anything, the pandemic has merely hastened and magnified trends that were already apparent before the virus struck." End quote. The fear of contracting COVID-19 has made us conscious of the traditional ways we use public and private spaces. Quarantined at home, we have readjusted to and recalibrated the idea of domesticity. Our pandemic-induced anxiety of being in public places made us suspicious of urban density and social proximity. Shifts in workplace culture are not only shrinking the city's retail and office areas, but also changing the very notions of home, office, and commuting. The pandemic has resulted in empty office spaces in many cities, provoking ideas as to how to convert offices into residential units and homes into home office hybrids. As tourism and business travel dwindle, the future of hotel space becomes increasingly uncertain. At the same time, we are rediscovering our love of nature and biophilic environments as antidotes to unsanitary living conditions and viral spread. We are rediscovering walking as both a healthy and spiritual practice. How do we build on these provocations to create built environment that is healthy, humane, and socially just? The 2021 Spring Panel Series provides us a platform to ask a host of questions as to how architecture, city planning, and pedagogy may change in a post-pandemic world. The series brings together panelists from diverse professional backgrounds, across the USA and beyond. Before I introduce the panelists, I would like to invite Dean Mark Ferguson to deliver the welcome remarks and inaugurate the Spring Panel Series 2021. So please welcome Dean Mark Ferguson.
Good afternoon, everyone. Thank you, Adnan. I can't see you, but I know that there are many students, faculty, alumni, friends, colleagues, and visitors here. Thank you for joining us. I'm Mark Ferguson, and recently appointed the dean at the school. Very happy to be with my colleagues here in this second semester. I want to extend a warm welcome to Liz, Francisco, and Catherine. Thank you for being here with us to share your thoughts, to respond to those important questions which Adnan has put forward. I'm sure you'll reply with a few questions of your own. This is our inaugural event. It will occur in 3 parts. I need to remind you of that, so you're welcome to come back for parts 2 and 3. And I'd like you to think of tonight as just one way that we have imagined our emerging post-pandemic world. This is our response. Virtual gatherings are now woven into our daily habits, particularly at work. The ability to connect across vast distances is just too convenient and too compelling not to do. So I know when our habits of getting together in person are restored, this is a way of getting together that we will not abandon and will be just as important to us as the physical office, the physical classroom, and the physical studio. So I look forward to hearing you all explore these questions and perhaps pose some tentative answers that we can take back and start to shape our future. Thank you very much.
Thank you, Mark, for for bringing us to the series, and I appreciate all your support to make this series possible. So again, thank you all our panelists. Today in the Spatiality panel, we welcome 3 distinguished panelists. Professor Barbara Klingheimer, who was originally scheduled to be one of the panelists today. Her father passed away and she needed to travel to Germany and to make funeral arrangements. So we will miss Barbara Klingheimer deeply in our panel today. However, we offer our deep condolences to Barbara and her family. I hope that she finds strength to deal with this family tragedy at this time. Let me introduce our panelists today. Francisco Javier Rodriguez Suarez, FAIA, is the Clayton T. Myers Professor of Architecture and Director of the Illinois School of Architecture. Rodriguez Suarez studied architecture at Georgia Tech, Paris, and Harvard GSD, where he earned a Master of Architecture with distinction, winning the American Institute of Architects Medal, Portfolio Award, and a Fulbright Fellowship. Rodriguez Suarez was the Dean of the University of Puerto Rico School of Architecture. He has lectured and taught at various prestigious universities worldwide. His practice has earned over 10 AIA PR awards, citations, and Biennale awards. Rodriguez Suarez is a fellow of the AIA and was selected by El Nuevo Dia newspaper as one of the 10 most influential pioneers in Puerto Rico in 2008. He recently finished his term as president of the Association of Collegiate Schools of Architecture. Liz York, FAIA, serves as Senior Advisor for Buildings and Facilities policy and innovation. She's a registered architect and received a Bachelor of Science and a Master of Architecture from Georgia Institute of Technology. She previously served as the Chief Sustainability Officer for the Centers for Disease and Control and Prevention. Liz has received 2 White House awards for sustainability, has been named to the Atlanta Business Chronicle's Sustainability Who's Who, and has been recognized by AIA as a fellow for her work to impact health and well-being by empowering architects to build better environments. AIA Georgia honored Liz by naming their Equity in Design Emerging Professional Scholarship for her. Catherine Dernstad is the founder of Latent Design, a progressive architecture and urbanism firm leveraging civic innovation and social impact to design for more equitable spaces and systems. Since founding her practice in 2010, Catherine and her firm have prototyped new urban design systems to advance urban agriculture, support small business, created spaces for youth makers, advance building innovation, and created public space frameworks. As founder of Boombox, Chicago's first micro-retail pop-up in a shipping container, she supported her over 150 small businesses and built new modes of finance. As the co-founder of the recently launched design Trust Chicago, she is seeking to re-establish a community design studio focused at a city scale. She and her firm have been published, exhibited, featured widely, most notably 80 Feet in the Air in Times Square for winning a Chicago Innovation Award, Underwater at the International Venice Architecture Biennale, the first Architizer A+ Awards, Chicago Ideas Week. She's the winner of the AIA Young Architects Honor Award and Crane's Chicago 40 Under 40. She previously taught at the School of the Architect at the Art Institute of Chicago and Northwestern University. I welcome all of you to our panel and to the Catholic University of America. Although virtually, I wish we were in person so that we could have seen you, touched you, and welcome you in person and give you some awards or something. But we have to survive in this virtual environment. So welcome to all of you again. My name is Adnan Morshed, and I'm a professor of architecture and architectural history in the School of Architecture and Planning at the Catholic University of America. I'm happy to serve as the host of this panel. Our panel conversation will continue for an hour or so, followed by a 25 to 30 minute Q&A, and which would be moderated by my colleague Tanya Onstad. So panelists, the people, the audience who are attending this presentation, if for the Q&A, please write your question in the Q&A in Zoom. Julia Prior, who is an MArch student, will curate these questions and transfer them to our Zoom chat room. But before we begin, I would like to ask Julia Prior to explain how people can get AIA, American Institute of Architects, continuing education learning units for this panel. Julia.
Hello all, again, hi, my name is Julia. You have the opportunity to earn AIA Continuing Education Learning Units in the Zoom chat as well as the Facebook comments. I will be sending a link that will bring you to a Google form, and it will ask you for your last name, your first name, as well as your AIA number. If you have any problems with this, feel free to message me directly in the Zoom chat or Facebook. Thank you.
Thank you, Julia. I appreciate it very much, and I appreciate all your help to make this series possible. So without further ado, let's get started. My first question to my panelists, it's a question, a kind of a little general to start off the conversation. The pandemic for the past 1 year has exposed our vulnerabilities at so many levels. Do you think it has posed an existential challenge for us to rethink how we use space and imagine our built environment? Is it a transformational moment for us to rethink architecture? Where is architecture heading? Who wants to go first?
I didn't know we were going to have a choice. So,
so take it on, Miss.
Well, so I think I would dive in and say that I do think it's a transformational moment, and that, you know, just like every architect in every age is responding to something going on in that age, this is our moment to respond to all of these changes that we're seeing all at the same time. I think you see the climate change crisis, you see the injustice and the civic unrest around that injustice, and then on top of all of it is this pandemic, you know, kind of, you know, nature fighting us back in a way. So I think this is a chance for all of us to take a look at the way that we're designing space, and you know, imagine other ways that it can be more supportive of defending us from these kinds of issues. And in my thought on this, it's more about providing space as a backdrop that helps people focus on the things that can protect them, the things that can help bring equality. So you know, things like better listening and clearer communication and more transparency. You know, how can spaces start to bring about some of these things? I also think that, you know, we probably are going to talk a little bit about airflow, but just the fact that designers, and not just architectural, but also the engineers that we work with, and you know, city planners that we work with, and policy people that we work with, having them all understand that there's more to the space that we inhabit than it just being beautiful, but it also needs to acknowledge that it has an effect on our health, and start to have designers build a lexicon of ways that they can talk about health in their designs. I think that this definitely is a chance to do that.
Okay. Okay.
I could say a little more. I'm thinking like, you know, Adnan, we hadn't really talked about this, but you know, some of these certification systems that have just been gaining support over the last few years, like WELL and FitWell, and even some of the LEED criteria are hearkening to promoting better health. And you know, this is something that I've worked on in my own career, is trying to take the public health science that's available and translate it into information that designers can use to create healthier buildings. And one example, I wrote an AIA best practice article on lactation rooms, you know, on this idea that women, when they return to work after having a baby, they need a place to get away, pump milk, and then take that milk back to their baby, because that is the healthiest way to feed an infant up to, I think that they're saying up to 1 or 2 years, depending on who you're talking to as your expert. And so, you know, the workplace was not really built for mothers to do that. And we've seen just in the past 5 years, with added knowledge about that, you know, providing this space, and then some policy work around the need for employers to provide both the space, the actual physical space, and a policy environment for having the time off to do that. Now we're starting to see this in the workplace, and it's an equalizer. It's helping mothers go back to work. It's helping them be a part of the society of the workplace. It's helping them connect back with that thing that, you know, we all strive to produce and be a positive, you know, coworker for you know, the people we work with. And this is giving them that ability. And what employers are finding is that it's creating great loyalty from those employees when they come back and they see that the employer cares about them and wants to provide. And it's a small space, but it's the act of saying, I understand your problem or your challenge, and I'm going to provide space and policy to support you in your challenge. So I think that, you know, you can take that as a snapshot and kind of extrapolate it. You know, we have, all of us have challenges, and, you know, COVID is one of them. And how can we as designers look for ways to soften the blow, or you know, support people in whatever challenge it is that they're facing.
Great. Thank you, Liz. Catherine or Paco, Francisco?
Yeah, I could jump in here, and I think there is a lot that Liz mentioned that is incredibly important and like helpful to think about and come back to as we continue through this panel. So we'll probably touch on more later. But one of the things that I think when you kind of look at this, the initial question about, you know, this existential challenge and transformational moment, I kind of think a little bit back to where our firm thinks we work in, right? We look at this intersection of design, of social and spatial impact through the process of define, design, deploy. But, you know, that's our mission statement within our firm. We look at that as defining the context, designing the content, and deploying a restorative solution at all scales. And as repeatedly mentioned, you know, the context has changed because of COVID, because of social unrest, because of this past year. So obviously the content has to change. And just while on this panel, as a country, we passed 500,000 COVID deaths while we were having the introduction to this panel. And that seems like an astounding and, you know, like unfathomable number. Like I don't know what 500,000 of anything is in reality. I've never seen it. And while COVID has exposed this common viral vulnerability, but I would have to challenge that our country's social infrastructure has been inadequate for longer than this past year and has impacted more lives. And we're seeing that also coming as another shift in the context and the conversation around context that we have to design around. And, you know, what makes this moment more transformational than the past decades with their moments of, you know, you talk about existential spatial dread. Why is this moment more transformational than other moments in time? I kind of, that's the question back to the question, right? And probably that will unpack on this panel. Because in my city of Chicago, just driving 3 miles west of my office where I'm at now, the life expectancy drops 30 years, almost 30 years. And that's a social and spatial change in what that neighborhood looks like and has looked like over decades that causes actual loss of life. And so we have viral loss of life that we all understand from this year alone. And then we have infrastructure loss of life and design loss of life that has happened. So an entire generation lost by just staying on the bus for a few more stops west of my office. And so we know architecture is powerful both with positive and negative influences. However, I think the transformational moment that comes to rethink architecture is not about a design of spaces. That's, I think, secondary. I think it's the transformational moment is to think about, can we actually be powerful as architects to change some of the infrastructure that we're designing systems around? Because otherwise we're designing spatial solutions for inequitable systems, and that's not, we're not using our power, or we're using a transformational moment to make power and restore access to some of these systems. So we could talk airflow, we could talk lactation rooms, but what happens when the majority of our essential workers who have kept us, you know, with paper towels and you know, milk and all of these things every day don't have the luxury to actually have a lactation room in their place of employment, or even the time off, you know, 15 to 20 minutes a day to actually do that? Right. So that's where we could use a spatial solution to talk about that, something that influences the infrastructure of a social inequity. And I think that's really what the transformational moment could be for architecture, you know, in my opinion.
Great. Paco, Francisco.
First of all, thank you, Adnan, for putting together this great series of panels, and certainly this one. And it is a pleasure to share the screen this time with you, with Liz, with Catherine, and thanks to Julie as well for all the support, and to Dean Ferguson, Catholic University. You know, in many ways, we're here in this panel. We're able to do this because of the situation that we are living in, right? That we're experiencing. I met you in an online review at Tulane, and then I joined you in an online review at Catholic. And after I finished this online panel, you know that I have another online event that I will be joining, and I know Liz has an online meeting afterwards. So in many ways, the very, you know, reason that we're doing this, that we can do this, you know, has to do with the situation that we're living in. And you know, I'm glad Catherine mentioned the terrible milestone that took place a couple of days ago when the New York Times had in the cover about the 500,000 deaths. And I don't want to minimize that in any way, you know, by abstracting my conversation and talking about, you know, design issues when we're living that in society, especially coming from an institution like the university, in a privileged one, right? My university tests me and my community every 3 days. I already had my first vaccine, and I'm scheduled to have my second one. We have 10 studios that are face-to-face. And so it's a very different situation, like Catherine was saying. What happens when you go 30 miles away of any of the places that we're having this conversation? And I'll frame it. I'll tell you a little bit about transformation, because as architects, we're always justifying the moment as a transformative moment, but this one certainly is, and it is in a way that we were not expecting it, that we were not ready for it, both in practice and in academia, and that maybe the way that it happened allowed us to take a step that I don't think, at least in academia, we were ready for. And most of the professors, especially design professors, will admit to it. As you know, I have been here at the University of Illinois at Urbana-Champaign as a director for almost a year. So basically the time of the pandemic. I started here in January. I remember I was traveling to Barcelona to visit our program over there when we heard about the first cases in Milan, right as I was beginning to fly back to Chicago, and immediately went into a lockdown and found myself having a faculty meeting, like most of you were at Catholic, and telling our faculty and our students that we would continue the semester after spring break, when everybody got back, that we were going to do it online, right? And that we were going to teach studio online, right? And, you know, in many ways, people went for it because it was a matter of a month or a couple of months, and then summer was going to be here. Everything was going to be over. You know, the heat or whatever people are talking was going to get rid of this, and things were going to go back to normal in August, right? And that didn't happen. And we had another faculty meeting at the beginning of that semester, and we talked about this not any longer as a way to finish the semester, but something that was fundamentally changing the way we taught and experienced design, teaching, the classroom, the campus, our immediate community. And we began to think of it in a very different way than the previous faculty meeting when it was about just getting it done, right? And also it's like, wait, you know, this is here to stay. This is going to change everything we do and how we do it. And we have to think about how we do it beyond our immediate spaces of the classroom, the lecture room, the studio, and into the community. All of a sudden, the projects that we were looking at were not the same projects that we were framing a semester before or a year before. And we were challenging ourselves to become relevant in a world that in many cases we were not. And we were trying to find a way for us to make a difference, to make a profound difference in a society that was asking, you know, that community 30 miles away, but even within the city, that our studios and our firms and our classrooms and our offices would now provide solutions for a world that was going to be completely different than it was before the pandemic started. And I think that's where we are right now. This is not merely the typical transformative moment that as architects we're always trying to justify. Yeah, this is a new time, this is a new, and this is the new thing. No, I mean, this is going to profoundly change the way we think, the way we do things, and the way we practice and we teach. Some for better, I hope so. I'm an optimist, and that's why I was, you know, in a way apologizing at the beginning, because I don't want to sound like these are silver linings to the moment, you know, to the gravity of the moment that we're living in. But I do see a lot of possibilities coming out of this for a profession and for a discipline to be engaged.
You know, I appreciate that optimism. Of course, you know, we have to see some silver linings out of these, you know, the social calamities, pandemics, and other forms of, you know, disasters. So let me pose one more question to all of you, and feel free to respond the way you deem fit. The past 1 year has been characterized by online interaction, Zoom classes, virtuality, social distancing, reduced presence inside buildings. But we also have witnessed a new era of global connectivity. And I'm sure Liz, Catherine, and Paco, you have been corresponding or communicating with people from around the world in many ways to address the issues of the pandemic. I would argue that our spatial behavior is changing. One could argue, if you look at the history, we see that in the wake of the Black Death in the 14th century, we see a lot of differences. Gothic architecture kind of dissipated. These complex gargoyles and complex facades were no longer deemed appropriate for addressing the pandemic viral transfer. So, and then we also know that the cholera in the 19th century created the response to cholera, a waterborne disease, created in many ways the modern infrastructures of sanitation. World's modern sewage systems was created in in London as a response to cholera as an epidemic, an epidemic. And then 1918, the pandemic created a lot of social, cultural, spatial anxieties, but that did not stop us to see a roaring 1920s. We see the emergence of cinema. We see the emergence of new generation of public spaces in the 1920s. Do you feel that space making as a result of COVID-19, this global pandemic, change in the future? What is the lesson learned from COVID-19? How will architecture change, the nature of architecture change?
Adnan, it's a good question, and I don't think I have an answer. I might take Catherine's plan and just ask you another question. But what I will say is, I think that we already are seeing this, that architecture needs to be more flexible in general, so that when things change quickly, it can be responsive. And it's funny that you mentioned the cholera epidemic. The cholera in London, that's kind of the birth of public health. The discussion you're talking about, that was the first time that a doctor started to record kind of the trends of what they were seeing. He was seeing, his name was John Snow, and he was recording where all the deaths were happening on a map. So this idea of, using GIS, it's kind of the same thing. And he started to figure out that what he saw was a pattern, that the deaths were all around one water pump. And so, taking that one water pump down and not using it anymore, that was the solution. That was the quick solution. There was a longer term solution about not putting a cesspool close to a water, freshwater reservoir that a pump was using for fresh water. But I think that this other thing that's happening. I remember your quote about that these kinds of situations magnify trends that are already in place. I think it was Norman Foster you said this. There are already trends around data and using data to make better decisions about design. And I think that, we're going to be using a lot more data than we ever have in deciding how we shape our buildings. And I'm not sure exactly how we use more data to be more definitive and keep architecture as flexible as possible. But these are the kinds of things we're going to be layering on top of each other as we're designing going forward. Mm-hmm. I don't know. I want to hear what Catherine and Paco have to say about this, because it's
yeah, and I want to give a real world example of kind of how that spatial shift is happening. Where in my neighborhood where I live, there's a lot of development happening, very rapid density, new hotels, new multi-use high rises. And so there's always a public meeting like every month for a new development that's coming into the neighborhood. And so last year, there was a development on one of the last little parcels of land around a park in my neighborhood. So it's the park because it's the only park we have in the neighborhood. So everyone knows all the developments, and finally one lot's getting redevelopment. So last year, you have the public meeting. This is all pre-COVID. So that's probably February. See the building design, you see it, it's too tall. It's going to be the developer dance. Everyone says it's too tall. They're going to come back in a couple months. They're going to lop off some floors and, change the facade a little bit and tell you they listened to you. That meeting happened, the comments as expected happened, but the follow-up meeting didn't happen until a couple weeks ago. And the developer came back, of course it's shorter, but one of the things, they radically changed the design. And one of the things that they did is they added all what they call outdoor rooms, right? So instead of just your typical balcony that fits a couple plants and grill, they added outdoor rooms. And so they made enormous 12 by 12 spaces. They said this is directly related to COVID. This is directly related to how people are working from home differently. We took that into the design of the building. This is what we're presenting. And it's like, so you saw that design response tied to what the development team interpreted as a shift of their clientele of how they would use the space. But of course, that clientele is incredibly affluent. The smallest space starts at, 900,000. And so, I kind of looked at that as to one kind of realm of how quickly people are responding to now you're able to work from home. You're probably going to keep some virtual aspect of your life moving forward because you can. You have to think about having more space because maybe, your family life has shifted and, now everyone likes outdoor spaces more. They want to be more satisfied with their own connection to nature and kind of this, the old fashioned 3-season room that we get in Chicago bungalows from the turn of the century. Now they're kind of building it into this high-rise development. And so I think that's one way you're starting to see that, but how do you take those same amenities and build it into all the other complexities of developments that are happening? How do you retrofit school spaces? And we're seeing that done in probably really poor examples. So you could have a panel in probably another year and it could just be showing bad examples of retrofitting classrooms for COVID and not spending the money on, HVAC or changing windows to operable windows, right? Because you have a whole host of this ebb and flow of architectural changes that respond to shifts in society. So, most schools became defensive in the 60s and 70s. So you have a whole set of schools that don't have operable windows and have no possibility of making them operable because it's following a defensive architecture thread of, social unrest of the 60s and 70s, right? And so now we need that again, and we can't modify. And so we have to go ahead.
Something else now, right?
Yeah, it does. It's completely different. Yeah. But that's kind of one thing that, example that I see how people are, how quickly also movements and developments are responding to current situations to say, like, here's our new offering, we see the market has changed and we're very quickly pivoting to respond to the needs of one segment of society.
You were talking, I was thinking of one of the projects done, graduate studio projects last semester that our colleague Anisha Dartwalker ran here at Illinois, where they were reevaluating and reassessing, how to use the public spaces of a campus, from the very large to the very small. But then it went further into analyzing the dormitories and how they worked and how they would have to be redesigned for them to what is a post-COVID dorm. And the fact that I've been here again for the length of the pandemic, and I'm in this house with my family, and as I'm engaging in this panel, my wife, who's a law professor, is teaching her class downstairs. I have one son who's in college, who's in the computer in one room, and another son who's a senior in high school who's in the computer in the other room, and everyone has their own schedule. And all of a sudden we meet twice a day at the dining table for lunch and for dinner, which we didn't before. I'm not going to say breakfast because they don't get up for breakfast, breakfast. But we are having a family sort of moment in lunch and dinner that wasn't possible before, and then we're finding ways of staying in that space that now has become it isn't the family room and isn't the TV room, is the dining table now, where then the chess set will appear, or dominoes or cards or something, and then it is transformed from being the kitchen or the dining table to the place where we engage when we're not each of us in our own screen, in our own little room that we have transformed into our working space. So I think that's an interesting situation that is taking place. Liz?
I was just saying, it's exactly what we're talking about. More flexible. It's able to be what you need it to be when you need it. And then you've got the added benefit of having the people all there, and then they are going to their corners and then coming to this central space to have that activity, and then they go away again. And technology is supporting them. I know I have a similar situation. I have seniors in high school and college student, and when everybody has a Zoom call, we can't do it, that it crashes. So we have to kind of, rely on other people's space too when we have too much going on. But yeah, it's the same thing. We're meeting for lunch and using that kitchen. No, it's about using space differently, and us as designers helping our public use space differently. Maybe it's by taking out the cues that tell them what kind of space this is and making it more rich in other ways, like connecting to nature, connecting to views, instead of it being maybe having a desk in it. It could be more of a general table. It doesn't have to be, this is office and this is dining. It could be more.
Maybe this is a good time to pose my next question. So I have been reading a lot of responses to the pandemic conditions, how our spatial behavior is changing, how we are responding to being confined to our places, to our homes, and so on. So one of the lessons of the pandemic is that single use spaces may not be feasible anymore in the future. A lot of people have been talking about that. Homes are also workspaces, as Paco, Catherine, and Liz talked about. They are no longer homes. They are also workplaces, but they are not designed as such. What is the future of domesticity, for example? Hotels and office towers are empty in downtown areas. Gymnasiums and schools are vacant. Converting them into some sort of hybrid space has become a major contention. Optimizing furniture to maximize floor space has become a major architectural challenge. Robotic furniture are being discussed. Perhaps we are also thinking about a new generation of Murphy beds. Swiss Army knife approach to space utilization is becoming a major debate in architecture schools and among architects. May I ask you a question? How do we imagine architecture as fundamentally multi-use?
I guess I would like to know an example of a single-use space. I mean, I can't think of any brief outside of some very technical or technical from a building standpoint or idiosyncratic clients where I have a single-use space brief. And, I look at, when you talk about domesticity, I think about open plan concepts and just how people use space already, or how even before we've had, COVID to deal with and other kind of public health issues, spaces seem like they were already multi-purpose, whether we wanted them to be as architects or not. I think that's one of the things where I don't see single-use spaces as something that truly exists, but I think it could be still thought of as probably even more important moving forward, right? And to what Francisco was talking about of the house of being this whirlwind of multiple activities during the day, and you gather at the dining table and you can hear everyone doing their own activities. Maybe there's an actual need for single-use spaces as retreats, right? Because our interpersonal space is kind of shifted so much, and we and our kind of like individual psyches have been damaged from this. I mean, that's a long-term, emotional and mental trauma that won't go away for years. So what if we think about it the other way? And the multi-purpose space has always existed. It's been, you know, maybe I would say decades or more since single-use spaces were truly available. And maybe we have to plan for single-use kind of restorative spaces to actually exist and say, no, this is the moment that we need, maybe at the domestic scale for sure, but could be larger, could be at the city scale. We need that.
So it makes me think of some of the work around office space and how we've been moving towards this space, instead of it being that you have an office that does everything for you. Now you have various spaces. You have like the coffee shop, you have the sofa next to the chair with the, you know, the computer screen on the wall that you can connect to. You have the table with chairs around it. You have the movable table with the mobile high chairs, you know, and whiteboards on rollers. So you start to give people these different types of spaces in the work environment, so that, and it's almost, it's more specialized. And I don't know that we're saying we're going to not have specialization, but I think what we're saying is that space is going to have to do kind of all of those things. It's going to have to be connective to technology. And again, I'm just talking about the workspace right now, because some people are not going to drive in. They're going to be remote. And then you're going to be connecting with people in, you know, for me in Atlanta, I'm connecting with you guys up in Illinois, you know, and it's fine. It's a great connection. And then I think people are going to want to do exactly what you said, which is get away. Sometimes there's going to be this cacophony of activity going on in one place in the office, and you're going to need to go and get away to be on a conference call or to, you know, regroup or whatever it is. So I think maybe what we're talking about, I know we're talking about single-use space versus multi-use space, but maybe what would help us think about it is thinking about the ways that people need to interact. Like, let's think about the mental map that we have every day. You know, we were talking earlier today about, you know, needing to I go out and run when I need to like think, and yeah, I think probably other people need to, you know, go outside to think, or go to a quiet space, or maybe it's a dark room, maybe it's a light room where they see nature. But kind of thinking about the way people think and the way they need to think. So focusing on mental health is just another facet of design that I think we're all, this moment is reminding us how important it is to think about that side of it. Not only our physical body, but our mental, where we meet the world mentally.
And I think even before we sit down with design intention to transform, you know, the existing typologies, or as we know them, or as we knew them, the market is operating in a way. I have a good friend who's a commercial realtor, and he told me, he said commercial real estate is down. It's inexistent. Office people are looking for a residential space, for a house or an apartment, or with an extra room than would have been their necessity a year ago. So that's the first transformation. It is the actual space that we would be looking at, but with an extra room that's going to become either the Zoom room or the to connect. I think people realize that this is something that can actually happen, and that in many ways, and I know, Adnan, you're going to have a future panel on pedagogy, but one of the things that has happened here in Illinois, and I'm sure at Catholic in other places, is that our students from China and Indonesia and the Middle East who weren't able to fly to the US, we are teaching them studio online with our professors from our Barcelona program that otherwise wouldn't have been teaching, because our students didn't go to Barcelona. So because they're in Barcelona, they can teach studio at a time that is feasible for the students in China and Indonesia and India, that we wouldn't have been able to do it here in Urbana, because otherwise, if they took studio here at 1 p.m., it would have been 2 in the morning somewhere else. So there are things that are happening that I think are going to be part of the conversation from now on. I think some of the changes that we were resistant to, both in terms of what we design and how we teach design, are really moving into something that is now easily accepted by all of us. And then I think we're ready to move into the next stage. And again, if Catherine, if this is an opportunity, not just, I'm not so much concerned about, the extra room that the restaurant is going to have, or the wider sidewalk that I'm glad that we're all going to enjoy. But how are we going to do with a community that is 30 miles west of where you work? And that's really what I would be concerned. Is this going to afford an opportunity for architects to intervene in places that otherwise they wouldn't have before? I think that would be the biggest transformation. Are we going to be invited to sit at a table where we weren't before and be part of the decision making that was taken in spite of our best intentions and not because of them? I think that's going to be the biggest change.
Paco, and I think that's exactly what we need to do, is to realize that you have a seat at the table now. Architects do at policy tables. Public health wants you at the table, and we need to. What is that saying? It's like, don't squander a good crisis or something. You know the one I'm talking.
Oh, that's from our former mayor, who said, "Don't let a good crisis go to waste."
Yeah. That's good. And not to make everything a silver lining, but humans are very adaptable. I mean, that's what we do. We figure out what's going on now and what pieces serve us and we'll keep them, and then what pieces do not serve us. And I think, Adnan, I know we talked about this earlier. I just dive in and say, I think that we are going to keep some of these changes, and others of them, as soon as we don't have to do them anymore, we'll forget them. But then when we need them again, we will dust them off and bring them back out. So, I mean, I think what we've done in the past year is learn a new set of skills that we're using because it's necessity. As soon as I'm allowed to go back out there and interact with others face to face, I'm going to want to do that. And so are other extroverts that are out there. But some people may say, I can do what I need to do from where I am. And, there will still be some connection with the way things were. But I agree with you, Paco. I think we need to sit at the table. We need to take these important lessons and start to help those who need us to help them.
Mm-hmm.
And I know I'm looking at the chat and the questions that two people I know well, Carlos Reimers and Carla Elefante, are posing some questions that I think, in addressing the going back to the table, here at the university, the branding office of the University of Illinois has reached out to us at the School of Architecture to sit with them and discuss wayfinding and design at the campus level, because this is going to be something completely different. So this has gotten us the opportunity to sit down at a table that probably and normally we wouldn't have been privy to those decisions. And now we can come in and talk about what is wayfinding and circulation and public space in a campus after the pandemic. So some of that is already taking place.
Okay. So, I think this is a good moment for me to ask another question, which is related to what we have been discussing already. We have been talking about, whether we are willing to talk about it or not, a kind of a quiet culture of cleanliness, a kind of a quiet culture of hygiene, social distancing, masking up. This discourse will probably become a mainstream contention. But I want to pose a question to you. While social distancing kept us safe and reduced the chances of viral transfer, will it somehow restrict our spatial domain, made us wary of contact and tactility? I mean, when you go to an office space, when you hit that 20th floor button in the elevator shaft, you are conscious. Oh, I shouldn't touch that button. It made us wary of tactility. Tactility has become the new villain. Touchability. So I want to ask all of you if you could answer kind of, succinctly, what is the nature of our architecture when we think about tactility, interaction, hygiene, and kind of our ability to see architecture as a democratic space that fosters interaction, camaraderie. We get to see people. On the other hand, we are becoming increasingly suspicious of anything touchable. So how do you see that debate being resolved?
I guess there's something interesting about this idea of cleanliness and modernity, right? So isn't that part of, I mean, I went to IIT, so it's a me school. So I mean, that's the only modern architect that's allowed to exist and take up space in my head. And so thinking about that and just thinking through how that was thought of as cleanliness, as democratic space. I mean, Crown Hall was, this is the idea of you have open free space and in everyone can have the same thing. And that's what democracy is we have all of that, everyone the same thing, and it's so clean. It has no nooks and crannies. You can see exactly what it is, and you know what it is, and it's a clean idea, and therefore a clean space. And I think it's a great question to really do some deep dive onto what constitutes now a visual, how do you make a visually clean architecture that connotes a sanitary space, and is there even a way to do that, right? Because it's become, health and wellness has become so personalized that, we might fall into the same folly of me's and modernism of trying to make a space for everyone and actually turning more people away. It's an impossible solution, right? So it's about making, thinking about cleanliness. Maybe that becomes an individual responsibility, another way that we decide of how we like hack spaces on the daily basis. Maybe it's just, we have a new Swiss Army toolkit of little hinges of devices to press buttons now. Who cares what the button is and what type of space it is? We'll still visually enjoy the space, but we'll have our own toolkit of devices to never have to touch it. And so that might be another way that we decide to enjoy architecture or enjoy space.
It's interesting you talking about the Swiss Army knife. It's making me think of these new little, it's basically hardware, it goes on the bottom of a door, and you can use your foot now to open the door, where before you had to actually pull a handle. And then there's all these new door handles that you can loop your elbow through and pull the door open. And those are tactile, but it's not the same, right? I think that we're going to have to be intentional about the ways that we make our buildings read as tactile. And have you seen this? It's a giant video screen, but what it's giving you is like a piece of art that looks like waves, or ocean waves, or it's very three-dimensional, even like crashes out of the frame. And I'm not saying everything's going to be digital, but that's a way that you could take a space and imagine the 3 dimensions when it's really a screen that you're not intended to touch, but you can still get this sensory experience of even tactility from being present in the room. So, I mean, I think we're going to be creative. I think we're going to figure out other ways. People are going to be wearing masks, and then they're not going to be wearing masks. And so they're going to be distanced, and then at some point people are going to say, okay, it's okay to be a little closer now. But you know, we are going to have changed the boundaries that we kind of allow people to come into and be in our proximity. But I think there are ways we can make space inviting and tactile without you having to go up and actually touch the wall itself.
Francisco, do you have any? Would you like to respond?
In a different scenario, I have been back to San Juan, Puerto Rico, where I'm from, twice since the pandemic started, and they were very different scenarios. We have 3 flights out of Urbana-Champaign, all in American Airlines, one to Dallas, one to Chicago O'Hare, and one to Charlotte. Thankfully, the 3 of them have a connection to San Juan, so I could go either way. And before, I would probably look for the cheapest option, right? And the first time I went to San Juan, I went through Dallas, and it's the longest flight from Champaign and then the longest flight to San Juan. And I was stuck on a full flight in the middle seat going crazy, right? But it was the cheapest flight. The second time I went there, I took the straight line through Charlotte, and it was also the smallest airport. I didn't want to deal with O'Hare or Dallas Fort Worth. I wanted to be in a place, you know, and I looked for a flight that had a couple of empty rows that I could reserve, with the middle seat open, and my 2 kids would sit on one side and me and my wife would sit on the other. So that is already, you know, telling you an idea that, you know, before I would buy airfares based on the airfare, and now I'm thinking about space and occupying, and what kind of airplane is it used, and what kind of airport, and can I get there on one flight as opposed to taking 2 flights, and that will completely change the way we you know, when traveling comes back. But also when I was back home, we had, you know, a townhouse in the city, and a house up in the mountains that has been under repairs for the last 3 years after Hurricane Maria. And then you have to understand that my idea of space also changed by being in 6 months without electricity in one place, not a couple of weeks like Texas. Or this is, you know, this was intense. And we were finally able to use that place, and it became the house where we stayed most of the time. And then the urban townhouse became the place where we came for 1 or 2 days a week, where we needed to get things and whatever we needed to be up there. So it's already, at least in my personal life, and that's why I'm using 2 examples, both in making decisions about traveling or making decisions about occupying a space. It's already completely changing the way that I used to do things into I don't want to call it a new normal, but a new way of operating within the kinds of frameworks that existed out there.
So, Francisco, what you were saying is that it leads us to think that in one way or the other, our spatial behavior is changing, be it in the plane or in our domestic space, in other places. It's kind of changing, and no matter whether we like it or not, we have to calibrate to the new demands of the situation. So, you know, I think that's fascinating. I had one other question, but given the time, I would say that, you know, I think it will come up in the questions, which is about density. You know, a lot of people, if you look at the op-eds in the last 1 year, op-eds in New York Times, Los Angeles Times, and Boston Globe, in many other key op-eds, columnists were kind of, I would argue, that premature in blaming density as a key problem in the viral spread. I argue that people, these columnists or people who are arguing that density is the problem, they were premature in thinking that it's the density itself. They overlooked the idea that in these densities, public health, investment in public health was not adequate. And I always give the example of Manhattan versus Bronx in New York City, two boroughs. Manhattan has the density, urban population density of 70,000 people per square mile, as opposed to 28,000 in Bronx. But more people died in Bronx. So in a way, it complicates this simplistic argument that density is the problem. So I pose this question, and I hope that you would answer, you give us a quick answer that it's not the density, rather our investing in public health infrastructures that complicated the COVID-19 pandemic situation. So the broader question is, how do we create social equity in our spatial practice in a post-pandemic world, not kind of simplifying the equation that density is the problem? If you could give a quick answer, and we can then move on to the Q&A phase.
I think that, together with the fact that some people, maybe in Manhattan, can choose to have the extra room to stay home and work from home, and maybe some other people in other areas, one, cannot have that extra room, and two, had to get out and continue to work regardless of the situation. So I think it also comes back to what Catherine was saying about the neighborhood 30 miles away, or the neighborhood across the river in the case of New York, or you know, how can we then help, you know, with those areas that may not have the same access to medical facilities, to healthcare, who will not have you know, the luxury of the extra room, or the luxury of each kid having a space, or each member of the family having a space to work on their own and then come back to a place that you can share. So I think those are all important questions that will result in many more questions. Because to think that we have it all figured out right now, or that we can come to conclusions or swift answers to each of the questions right now, I think it's not realistic. I think we're really just beginning to there's two issues here. There's one of survival, and once we get to the other side, there's another one of understanding what happened and how do we make it different.
So I want to build on that just a little bit. I agree that I don't think density is the villain. I think that for a very long time, our policy environment and our physical environment, and to some extent, what do they call it? Predatory capitalism. I mean, I think a lot of things have been working towards this idea that has created an inequality around health. So there's no justice with regard to health outcomes and access to health care and access to spaces where people can exercise or walk or participate in their own mental health, physical health, you know, all the realms of health that WHO kind of outlines. And what we're seeing is that the people who are not healthy, the people that have had these inequities already in their lives, are the people that COVID is affecting the most. And so we can say that it's a problem of, you know, hygiene or density, you know, we're too close, or we're getting too much, you know, too close to each other, too packed in. But really what we're finding is that people who were already dealing with stressors and, you know, already had heart disease, already had diabetes, they're the ones that were hit the hardest. And so what we're seeing is that it's not that it's an infectious disease problem only, it's a chronic disease problem also. And we as designers can affect chronic disease health for the populations that use our buildings. And we can do that by making our buildings engage you in a physical way instead of trying to, kind of like what Catherine was saying, be the same thing for everyone. A building that's the same thing for everyone really is only meeting a very few of the people that are entering that building. Whereas a building that's providing a variety of different things to different occupants is more equitable, just in the fact that it's trying to speak to people where they are. I don't think it's density. I think it's a whole host of other things, and they've been compounding. And now is our chance to make change and be thinking about these things as we're designing.
Catherine?
Yeah, and I think one thing, there's a kind of the public space thread that's going on in the chats and the discussion, and it's overlapping with this density discussion, because I think one of the items, it's the contradictory terms. One of the things that make great public spaces is the density of people and the amount of activities that are there. And it's a concern that that kind of level of activation might not happen anymore, not only because of continued social or physical distancing requirements, but then our own modified behaviors, right? Or if we're creating public spaces moving forward, what do we have to take, or any type of space, what do we have to take into consideration because of the pandemic? I mean, I'm sure most practitioners on the call in the past year have had at least one brief or conversation with the client, or a new or current client, where they have asked you to remap or redesign a space, or show them how desks would work in COVID. We have multiple briefs now where that is actually a requirement, all the way down to how we render a space that we're designing. They want to see it with physical distancing requirements. So that's, you know, the spatial considerations have fundamentally changed to always take that into account. I think we're forever changed with that. One thing that we are working on is, interestingly, we've been working with the Mayo Clinic in Rochester, Minnesota for the past couple years around redesigning their public space downtown. And so they thought of it as a public health outdoor space, and the quality of it as a public health issue, the same way the neighborhood 30 minutes, 3 miles away thinks of has health impacts. They saw it the same way. They started with this kind of very simple idea of, if a doctor at this world famous institution wants to tell their patient to go for a walk around the block to get exercise, and that's part of their, that's part of their wellness regime to get better, what does that block look like? And that started a thread for them around, we have a terrible public space infrastructure. Their downtown has 5 benches when we started. I mean, you think about Mayo Clinic, and they have like 5 benches and 12 trees, and you're like, really? That's, yeah, it's impossible. And so what we were starting to work on is, when we were working on this project, we were already starting to think about these distances and spaces to think of gathering across different cultures, mobility when you're in different stages of recovery, ideas of viral transmission, or thoughts about if someone's not necessarily contagious, but you think they might be sick because they're moving a little bit slower, they have a cough, but they're not really contagious, what those distances are. So, and how do different people of different mobilities, not just accessibility, but if you're, I saw it was mentioned in the chat, Gallaudet University, if you're deaf in these wider hallways, we were thinking about all of this before, and the magic number was everything had to be a minimum of 5 feet, and then COVID came, and now the magic number for everyone moving forward is 6 feet, right? But we were already trying to think about those spaces, and it wasn't thought of as a space for a public health crisis to occur. It was thought of as a space that allows people to gather at any range of ability, of age, of family size. It was thought of as a very positive way to think about public space. And sure, that increased cost to think about, well, we have to do a completely curbless infrastructure to cross the street. We have to think about the tactility of our ground. We have to think about the amenities, and sure, that cost increased, but it was all for that long-term benefit of trying to anticipate change in how we gather outdoors moving forward, because it was thought of as a positive thing. And now the space still works with minimum modifications. I mean, it's under construction. It will open later this year. So there is minimum modifications that needed to go into the design to accommodate thinking about physical distancing in a public health crisis. And I think what that public space conversation comes down to is, you know, we weren't designing for the worst case scenario. We were designing for the best case scenario of living outdoors and what works, and that actually happened to correspond with creating a space that allowed, you know, society to kind of like fail safely outdoors too. So it's like thinking about best case scenario through all this, and I would never think of the space as being designed for a public health crisis. It just happened to be able to accommodate that, and I think that's a testament to the design thinking of the team, and we'll see how that plays out as it moves forward, right? Because now that we were thinking about how businesses use the space and how, you know, doctors use the space, how patients, and how do you actually create an amenity that makes all your resident doctors who come for 2 years actually stay in the city and not go to Chicago or LA or New York or somewhere else, stay and build up the community of that city.
All right, thank you. Thank you all. You know, I think it's a good time to move on to our Q&A session. And I would like to invite my colleague, Tony Onstad, to join us to moderate the questions. So we got a few good questions. We have a few good questions. And I know that Tonya, you have a good question. So, you know, Tonya, go ahead and present the questions to the panelists.
I'm not sure which, well, so I didn't see the question. I couldn't see them before, so I have to do a quick reading now. But I did have a lot of questions as we went along. Really nice to meet you all. Thank you for sharing your expertise with us tonight. One of the things I was thinking about during this was, you know, what is this thing like? Okay, we've been thinking about this nonstop, right? From the beginning, everyone's in a different situation. People all have good, bad, ugly responses to the pandemic. And some days it seems like we've stumbled across something really amazing, and some days it seems just insurmountable. But my question would be, what do you think is sort of like one single really big architectural impact? So what is the one thing that we're not going to lose? And I think Adnan kind of got at it a little bit with this space, like multi-use space kind of question. That's one way of thinking about it, I guess.
But Tonya, I like your one single moment. I like that focus. So let's go with it.
Paco, go ahead.
I'd like to think it's public space. I'd like to think it's public space in the city. I like to think people are looking forward to getting together and sharing space.
I think what we won't lose is, and it's probably going to increase the need for visual delight if we're not going to be touching and as close to spaces anymore. I think maybe it's about time for some Vitruvian delight to finally beat out firmness and commodity, for at least for a couple years. Why not? Just make it delightful.
Yeah, and I think it's going to be outdoor space. I think it's going to be programming outdoor space and investing in outdoor space. Of course, I'm in the South, so there's a longer time period where we can use those spaces. But I think that we're going to start to figure out how we can use those spaces in other climates as well. You know, maybe it's exhausting air through those outdoor spaces so that it's tempered slightly. You know, maybe it's increased kind of solar heat gain in those outdoor spaces. But I do think that people want fresh air. They want to be outdoors, and it's been such a popular thing to, you know, get together on a front porch or have that 12-foot balcony. That would be great. The 12 by 12 outdoor. But I see people doing that all the time, and I mean, I'm hopeful that we get to keep that.
There was a question there by Carlos Reimers talking about suburbia, and maybe one of those places that gets a lifeline and a boost. I'd love to see what there in Atlanta, what Ellen Dunham Jones, who just presented her second book on retrofitting suburbia with June Williamson. What if there's going to be now a post-pandemic book on analyzing suburbia?
That's a great thought. You know, the other thing that I hope we don't lose is the idea that health is part of our job as architects. You know, we talk about health, safety, and welfare. We have to get health, safety, and welfare credits every year. And basically what that has meant for many, many years is safety. So I'm hoping that the health and the welfare are here to stay in our definition of what our charge is to the general public, that we're protecting their health, their safety, and their welfare.
Yeah. Tonya, can I respond to your question very briefly? You know, I think a pandemic or not, we should not lose the sight of architecture's power to change, transform, influence society. We should not lose sight of our space's power to make the world a better place. So no matter where we are transforming our domestic space to adapt to the new needs of the pandemic era, home quarantine or not, but we should not lose the sight of the architecture's power to change the lives of 10 people, 20 people, 30 people, and make their lives better.
So we have a question from, I've just sent out to everyone. Please throw your questions in here now. I will read as quickly as I can, but we have a question from Julio Bermudez, who some of you, I think all of you know, are distinguished faculty here at CUA. So he asks about how the pandemic has affected our sense of self and community. I think that's kind of interesting, the self and community part. Are we more compassionate, understanding, spiritually sensitive? If so, how do we harness such effect urbanistically?
Julio, I'll answer it from the perspective of an architectural administrator in the sense that I wanted to make sure that every student who wanted to be online could be online. Every student who wanted to be face-to-face could be face-to-face. Every professor who wanted to be online could be online. And every professor who wanted to be face-to-face could be face-to-face. Now, doing all of that within the same schedule, as you can imagine, it took a lot of commitment and desire to make a difference and working, an incredible amount of hours just to coordinate it, and especially with the students who were not in Illinois. We wanted to create a space for them to be able to take the courses. Now, I think that's going to open another door, and I leave it open here for Adnan to discuss when you talk about pedagogy. And it's I think, going beyond what Europe went with the Erasmus program, which really meant that you could go, that the university as a one place could change different places. Now, I think that once online education, the kind of experience that we've had, that the sense of place is going to be completely transformed. And the crazy thing that I'll put out there is that there are some students, maybe the university is not ready for that, but there are some students, and there's going to be a market for students to be able to take one class with one professor in one university, one class with another professor in another university, in another country, so that maybe somebody in one room will be taking 4 or 5 classes with 4 or 5 different professors in 4 or 5 different universities. I think that's going to be one of the biggest changes brought by this acceptance of online education in post-COVID. Call me crazy, but I think that's where the future is heading.
I love that what you're talking about is more individualization, and that the driver is the student. I think that idea of more individualization is definitely, I mean, I've seen it over and over, is that now that we can provide this, we are. And I think we are more compassionate. I mean, I think that is the definition, thinking about the individual and what the individual needs, is us acting more compassionately. And this is just kind of a funny way, but I think it demonstrates that the way that we're all kind of feeling right now, individually and collectively, in a community, we're all having to learn. And again, this is kind of funny. It's kind of funny. We're all having to learn Zoom, and then, you know, Blue Jeans, and this meeting, GoToMeeting, and Teams, and, you know, Skype. And we're all, you know, every meeting you get on, there's dogs barking in the background, and people apologizing, and people saying it's okay. And then people are late because they can't get the technology to work. And then people are getting cut off in the middle. And, you know, what I think we're realizing is, because we wouldn't have given people the benefit of the doubt, we would have been saying, gosh, they didn't come to my meeting, you know, but because we're all facing this at the same time, I feel like we've become much more accepting that people are people and they're doing the best they can. And I hope, kind of connecting to the last question, I hope we get to keep that idea that, you know, it could be worse, and, you know, they probably just can't get the Skype thing to work right. So they'll be here in a second.
Thank you. Yeah, I think the shared domesticities is really something that it felt really like we never met anybody. And then all of a sudden we know that you like plants, and, you know, anyway. So, but there's 2 really interesting questions. They're starting to come in now, but one from a student that I'd like to bring up is a question from Mo Arbach that asks simply, what is the connection between designing for inclusivity and designing for resilience? So I'll leave that for you guys.
Yeah, and I think, Mo, I was trying to get to that in the story of the Mayo Clinic, is that Venn diagram is just a circle, right? So I think when they have to be one and the same. And I think when you do one, when you just think, if you're thinking about designing for inclusivity, you're also designing for resilience, because you're really getting into the life and the detail of maybe one subsection of an audience, right? When we were thinking about just mobility issues for public space, we really got into what does mobility look like at a variety of ages, of whether you're on a path to recovery and repair, or whether this is a chronic issue. Just even looking for that helped us start to even look at resilience issues, because you are looking at a space that's trying to support someone over the life cycle of their either recovery and repair, or just their life, right? So that becomes a resiliency question. So I think they're one and the same, and I don't think there's a way to decouple the two in a design conversation.
I also think that there's this idea of what could go wrong, you know, that when you're doing resilience, you're thinking like, what is the worst thing that could happen? And you're kind of looking at those worst scenarios and trying to address how this space could help the community bounce back from, whether it's a terrorist event, or a hurricane, or you know, a flood. And I think that when you're thinking about designing an inclusive space, you're also thinking about different perspectives. So it might not be what's the worst case scenario, but it might be, okay, what's this segment of society, or these these kinds of visitors or these people that inhabit the space all the time. You're thinking from different perspectives. And I think that's what gives the design richness and makes it, I guess, more responsive to the questions that you're trying to address, whether they be resilience or inclusivity. It's the same. I think you're going through the same process.
Another great question. I always think these questions bring us back to kind of zoom out a second. This is from Professor Milton Schinberg. He asks, is architecture a medium that can or even should help to heal a sense of vulnerability and unpredictability that came with COVID? Traditionally, architecture has been seen as a reinforcing symbol of stability. So he's kind of asking, should we even do this? Or is this really even our job? I kind of love that question. The zoom out question.
It is a good question. And I'd like to think that we can. I'd like to think, going back to the issue about compassion, I'd like to think that I'm seeing a change of perspective that was already taking place with this generation, even before COVID, about what students were interested in doing and achieving with society as a result of their work. And I think this could be, something that reinforces that general direction that was already taking place.
And for me, I'm a little bit torn on that question. As part of me is, I think it is very much not our job, but we want it to be. And I think that might guide, because I think the question of architectural stability is a reinforcing symbol of stability. I think that is very true when you think further back in the histories of architecture. It absolutely has, a visual impact of power, of stability, of all of these other aspects of how we understand buildings absolutely runs into architecture. But when we start to think about vulnerability and unpredictability, I think our current standard of building actually reinforces that. We were talking earlier before the panel started internally about the weather and the snow and the frost, and this is the time in Chicago where if your roof has, if you don't have a 2-story tall icicle on your back porch, or you're completely frozen out, it's going to warm up in 10 degrees this week, and so your basement will get flooded, right? And so that's a symbol of kind of like current construction and development instability, because we're not building at the same quality. And I don't think that's an architectural problem. We could design it, but it's not an architectural problem because it's an implementation problem. And I think that goes back to earlier conversations where we kind of like, at least myself, alluded to, let's think about where our power is in this situation. And is that the transformational moment right now is to think about where our power sits and how we could actually make not only design solutions, but shift those to think about design and systems of influence of design, and how we could actually start to create access and implement those. So that's kind of the shift, kind of tying it through all back together through that question.
Yeah, I kind of read it a little differently. Where my mind went talking about symbol of stability was to the home, and the fact that we've been spending a lot of time in our homes. And then also just, I know for me, I'm longing to get out there and be in the world again, in the built environment itself, and kind of looking for architecture to be a place where we come together again. I mean, I look at all you guys on the screen, and what I really want is for us to get together and go and have a beer or a glass of wine and talk about this stuff sitting in some beautiful architectural location, probably outside, with water, like a fountain, and sun dappling across, So my point being that I miss architecture as another place to call home or to call us together in community. And I think that could be a way for it to heal kind of that vulnerability and unpredictability, but not because it's like a firmament, but more because it's a place of convening. That's what it's making me think about. That
Yeah,
question.
like architecture as the character in this relationship.
Yeah. Like that.
I have another question that's precipitated by the sort of tactile is evil in this modern world, especially in COVID. I was thinking about what kinds of things we can do to sort of dial that back post-COVID. And I was thinking about how sustainable and high-tech buildings are also, they sort of reinforce that. So a lot of buildings are really touch-free. And I immediately started to think about the sort of resurgence of earth construction, and just curious and I get excited about the potentials with other sort of new earth construction type technologies that we could use in the future. What kinds of things do you think could in architecture as we move forward to sort of break away from this architecture is evil, hands off? That's not as clear of a question as it probably could have been.
No, I think the question is clear. I don't think the answers are clear. I like I said before, I think we're still digesting the situation, and I think it's hard to be both in survival mode and creative mode, or maybe it isn't. Maybe that's when you get most creative. I kind of think what I would like to see, but they're not necessarily things that are particular to this moment. Maybe this moment will make them possible, and maybe I've wanted to see them for a long time, and we're trying to justify the moment as a catalyst for some things or some ideas that we've been developing for quite some time. And I keep going back to public space and infrastructure, right? To me, that's going to be the key. It's a place where we all come together, and we still need to come together, right? It's going to be the need for sidewalks, for trees, as you were saying, and benches and places for all of us to come together. If in residential is going to be that extra room, what is going to be the equivalent of the public realm, of the urban realm? What is that extra space that we're going to need for all of us to come together and for all of us to feel safe and going back to exchanging in proximity?
I think I am going to say thank you to you all and hand you all everyone back to Adnan. I think that answers a lot of our questions from the students and faculty. And
thank you, Tonya.
Thank you
so much.
Very much.
Thank you, Tonya. We really appreciate your, contributing your time to take care of the questions. I am sure the students, faculty, and the audience who are tuning in learned a lot from your insights, from your reflections. And I would like to thank you, our panelists. Thank you for your insights. And it's an evolving situation. Post-pandemic, nobody can say that it's gonna be this way or that way. All we can do is offer our reasoned insights as to how this post-pandemic world unfold, and how we can make our world a better place for everybody. And in our respective works, Paco, Francisco, Liz, Catherine, Tonya, Julia, Mark Ferguson, our other audiences, we always think how we can use our expertise, our knowledge of architecture, our insights into space, how we can make that a useful tool to change the world and make the world a better place. I think in our unified goals, we are all the same. We all want to make the world a better place in one way or the other. So no matter what happens in the post-pandemic world, we all want to use our knowledge of architecture, our expertise in architecture, our forte in space making, to use that the world a better place. I think we are all unified in that endeavor, in that enterprise. I want to thank our panelists, Francisco, Liz, Catherine, for taking the time to participate in this panel. We cannot offer any conclusive statement. What we can offer always our insights, our understanding of the world, our understanding of the world around us. So that's what we try to do. This panel, the goal of this panel has been to offer insights into how we can imagine, engineer, and reinvigorate the world of the future. The world that works for everybody in a just way. I think that's all we can do. And we can use our knowledge, we can use our expertise. Catherine, Liz, Francisco, all of us are in a position of privilege. How do we use our privilege, our knowledge, to make the world a better place? That's all we can do. No matter how the post-pandemic world unfolds, we do not know. We cannot say for sure, but we can always try to make the world a better place. So that's all. So thank you. Thank you to our panelists. And I would like to thank our Dean, Mark Ferguson, for enabling this panel, for encouraging, supporting, and sponsoring this panel series. And I am sure we will be having much more interesting, stimulating conversations in the future. The next one is coming up on cities on 15th March. And then how we deal with our education, pedagogy on April 12th. So again, I would like to thank Julia Prior, Evan, and Paula for taking care of the technology side of this, and all our audience, all people who participated in this and were patient to observe, listen to what our panelists had to say. I thank you all, and I hope that you will be able to join us again on March 15th to talk about our cities in a post-pandemic world. Again, I would like to thank Francisco, Liz, Catherine, and I wish you all the best, and be safe, be healthy, and make the world a better place. Thank you.
Thank you, everyone.
Thank you so much. Thank you all. Bye-bye.
Bye.
Bye.